Good afternoon, and thank you for joining us on our weekly media briefing and public health update. Today, joining us and leading this media briefing is Rich Marolino, who is our Chief Administrative Officer in Montgomery County Government. Good afternoon, Rich. Thanks for doing this. Joining us today as well, we have Dr. Keisha Davis, who is our county's health officer, Dr. James Bridgers, who is the Director of the Department of Health and Human Services. We have two very special guests today. We have Captain Jason Light from the Montgomery County Fire and Rescue Services. He's here to talk about the Hawaii deployment. And we have Luke Hudson, who is the Director of the Office of Emergency Management and Homeland Security. He's here to talk about National Preparedness Month, which is coming up in September. Thank you, everybody, for joining us this afternoon. And with that, I toss it to you, Mr. Marolino.
Thank you very much, Lorna. Thank you, everyone, for joining the call. It's my pleasure to sit in for the county executive this week. He has the week off to get some much needed rest time. So, but the news never stops. The work of the county government never stops. So we wanted to make sure that the press knew what was happening, especially considering that this week is the first week of school and that Labor Day is on Monday. So the county executive wanted me to start by saying a happy Labor Day to everyone in the community, but especially to the 10,000 plus individuals who work for the Montgomery County government, whether it's police, fire, community nurses, correction officers, crossing guards, accountants, or public information officers. All of you do a wonderful job on behalf of the million-plus citizens and residents of Montgomery County, and it's a good time on Labor Day to say thank you, as we should every day, to say thank you for the services and the commitment that you have to the people of Montgomery County. We greatly appreciate your service and look forward to celebrating you over the next few days as well as year-round. And, of course, for the big parades that will happen in Kensington and Gaithersburg on Monday, even though it's supposed to be a very hot day in the forecast right now. Today, we're going to hear, as Lorna mentioned, we're going to hear from Captain Jason Light with our Fire and Rescue Service, who just returned from Hawaii and the Maryland Urban Search and Rescue Team's deployment to Maui to assist in the recovery efforts on Maui as a result of the horrible fires that occurred. He's going to talk a little bit about the work of the team while they were in Hawaii. This was an incredibly physically and emotionally difficult work. We certainly appreciate the sacrifice that they made by going, and of course the sacrifice their families made in supporting them while they were gone. We had almost 10% of the crew that was on the ground over the last several weeks helping out with the recovery efforts. It was probably unlike anything our search and rescue team has done. It's wonderful that Montgomery County supports the search and rescue team. I think it speaks to the generosity of this community that we are willing to prepare people, staff them, employ them, equip them so that they can respond around the country to emergencies. Our good friends across the river, I know the Virginia team was just sent to Florida as the Maryland team certainly bounces around. If they hadn't been in Hawaii, they probably would be going to Florida. With that being said, the hurricane hitting Florida is also a wonderful time to talk about Emergency Preparedness Month, which starts on September 1st. Obviously, if you've been watching the news today, you've seen the reports about what's been happening in Florida, and so many people, fortunately, moved away from the coast because they got those emergency alerts. And we're going to hear from our relatively new director of our Office of Emergency Management and Homeland Security, Luke Hodgson, about the importance of preparation for every household in the county, for the businesses in the county, as well as what people can take advantage of with the services that we provide to help you get prepared. So with that being said, I am going to turn it over to Captain Light to talk a little bit about the work that he and 50 colleagues did in Hawaii, and to tell the community about their work and, of course, what we can do to continue to support the people of the Urban Search and Rescue Team. So with that, Captain Light.
Well, first, thank you for having me as representing the team Maryland Task Force 1. And just to start out, this mission and what we did over in Hawaii and helped the county of Maui and the locals there could not have been, we wouldn't have been able to do it without the support of county government, the state of Maryland, and every entity within that helped approve and help get us over there and support us throughout the year. So I received a phone call. I went as the task force leader, so I was in charge of the 70 personnel that deployed on the evening hours of the 15th is when we were notified if we would be able to support a Type 1, which is a 70-person team, and it's our full capabilities. With approvals, we were able to fulfill that for the FEMA USAR branch, and we had our official activation orders on the 16th. That first day, the first challenges started with trying to find air movement of our team and our cache of equipment. And the cache of equipment is roughly about 60,000 pounds of equipment that had to be flown from the East Coast all the way to Hawaii. The team management worked through those hurdles. We're able to secure an airline. And it was roughly 10 o'clock East time, the 70 personnel were in the air. And there soon after, the next day in the morning hours, our cache of equipment were there. We arrived safely, got well-needed rest that night, and then the very next day, we went to work with the FEMA Incident Support Team. Is who we answer to. They give us the mission objectives. It was us and 4 other of the 28 urban search and rescue teams there, and that's where we went to work. We worked for 8 straight days, and everybody seen on the news what happened. The scope of the mission, we knew what we were going for. It was very mentally and physically demanding on all the team members. I can't go into a lot of details. We're still under a lot of no talk guidance, no photos through FEMA and the county of Maui because of the cultural sensitivity of the mission, what happened there. But I can give a little brief overview of what we did and how our members worked. I mean, they were top-notch, high energy the entire time. Professionalism was paramount. They did a great job. And what we did was essentially methodical searches over divisions of areas that were given to us. And these searches contain a lot of delayering of structures. The unsung heroes of the whole deployment for all the teams was the canines that were there. I believe there's upwards of 40 canines through all the teams from the system were there. And the objective was literally to search every inch of the structures in the streets and the vehicles that were within our division. And it was a very slow, methodical process. The individuals on the team were complete full PPE. That ranged from helmets, steel-toed boots, long sleeve BDUs, dark colors, respiratory protection in the Hawaii heat. The temperatures were, I would say, looked good on a screen, but the Maui sun was very, very hot, and these guys and gals didn't falter one bit. They worked hard. The majority of our structures we searched were all 2-story structures, some residentials, a lot of apartment buildings, and a lot of commercial buildings down along the waterfront where when the tragedy happened, where a lot of the people converged to. Those were our areas of search. They worked hard. The days were long, approximately 10 hours a day, rotating through an air-conditioned bus and then back to work. This deployment ranks up there with the ones of Oklahoma City, 9/11 that our team responded to. We all went in with an idea of what we thought we were getting the mission was going to be, but it was way more difficult, challenging than we originally thought. And the guys and gals were phenomenal. By the end of the mission, you could see in their faces their exhaustion. They never once faltered, slowed down, and just kept going. Just a true testament of the individuals that are members of this team. Couple things just to note, just to show the high level that the Maryland Task Force 1 worked at. Just some of the little personal things. The canine handlers, everybody wanted to work with Maryland Task Force 1. They enjoyed the way we brought them into our team, the way we operated in a methodical fashion that the IST wanted us to, so that no inch of the area was left unturned. We did a little ceremony on one of the last days with the Maui Fire Department, who was with us and had been working hand in hand with us for the durations of each day. And it was pretty emotional when the Maui Fire Department, we exchanged a Maryland flag for a Hawaii flag so that the Maryland flag could be hung in their firehouse. And when he broke down and said, we've worked with all the teams, and we only want to work with you guys because of the way you make us feel as a members of your team. And I think it's just a huge thing that they thought that much of our task force, the way we operated there, and showed how the team worked. We worked for 7 straight days. As things started winding down, we were one of the last teams to mobilize, and we arrived back home yesterday morning at 01:35. Once again, finding our own flights home, which was a challenge for 2 of us there, but we were able to successfully do it. We currently still have 2 members of the team in Maui with our cache of equipment. They will be coming home once our cache is airborne, which will probably be roughly the beginning of this coming week. But yeah, it was a true testament to our team that we can adapt to anything. All of our disciplines were engaged at the top level of doing what they do, even down in the little things that really made this mission successful was like our medical discipline. The doctors and the medical specialists put together essentially a foot care center every morning and every evening. They would help wrap members' feet, make sure they have proper moleskin on them for any hot spots or blisters, just so we could continue to work at the level we were. They checked them in the evenings. In every discipline was engaged and adapted to what we needed to do to complete the mission we were tasked with. I've been a member of the team for approximately 17 years now, and this by far was one of our top missions, mentally, physically, and we went out and did it. And to the reviews and the raves of the incident support team, I'm still receiving messages of how happy and proud they were, how we operated, and they knew that they could count on us. So, and it all comes back to the support of the county, the training that the men and women do on a yearly basis. And thank you for your support and getting us out the door and making this team in the state of Maryland look really good.
Well, thank you, Captain Lake, for what you've done to make us look very good. Now, I think, I don't know if you said this in your remarks, but Maryland Task Force 1, which is hosted by Montgomery County, primarily staffed by Montgomery County, it included colleagues on this mission from Howard County, Anne Arundel County, Prince George's County. Am I missing somebody?
So our team the home agency is Montgomery County, and we have supporting agencies that are also members. They are Frederick County, Anne Arundel County, PG County, Washington, D.C., and Howard County. This mission was made up of Montgomery County, Prince George's County, Howard County, and a few folks from Washington, D.C.
Yep. Didn't you even have a doctor from Pennsylvania who was part of the team?
We did. So in order to deploy, we have to have two physicians with us. One of ours was able to go, and they're probably one of the toughest ones to get on deployment. So we could confirm one, and Pennsylvania Task Force 1 graciously loaned us one of their doctors. And he, once again, we brought him into the team. He worked with us, enjoyed working with us, and really, really helped us. He was actually the primary guy who really started the foot center, we called it. And he did great. And that's how we work. I believe we actually are loaning one of our doctors as we currently speak. I seen this morning an email to Fairfax County for their deployment to Florida right now.
Yep, we have a doctor in Orlando right now working with the Virginia Task Force because we know Fairfax County needs help.
So, oh yeah.
Just wanted to reiterate two things that you talked about, and then turn it over to Lorna for questions. One, you used a term which I personally had not heard before this deployment, and that was delayering. And my understanding is one of the things that made this mission so difficult, physically and I think mentally difficult, was you were actually having to take apart homes by hand, structures by hand, because they did not want to use actual mechanical equipment.
So it started with that, yes. Our structural engineers would size up the building to make it safe, what we need to do. Some of our members would make it safe using different tools and stuff we have, shore it up. And then, we'd have to take it apart piece by piece. A day into our mission, they were granted and they brought in some heavy equipment. And we worked hand in hand with the Alpha Contracting out of Maui. And those guys were top notch. Once again, we brought them into our team. And they were one of us. And some of our heavy riggers would work with them, and they would actually pick apart the buildings, bring them out. And as they would bring them out, we would search them, and until we pick apart every building, every house, and then make sure, like, once again, just every inch had to be covered with a canine and members down sifting through ash.
And then the other thing that I learned in the conversations and the reports that were coming back, you mentioned, the temperatures in Maui, and that, when you look at it from, a weather app and you see the temperature, it sounded not that bad, but the heat that still remained in the ground from the ash. I mean, I remember getting communication back from the team about having to send different shoes for the dogs, for the canine unit, because the heat from the ash and how it was impacting them. So that made it a different type of deployment and an added challenge, which is why the foot care was so critically important.
Yes, there were still some buildings that were smoldering underneath that once we got to that and recognized it, we would have the local Maui Fire Department come in and put some water on it. The average ground temperature in the afternoon was upwards of 170 degrees. So the canines, the veterinarians were able to come up with these little booties that they wore, which was huge, because, once again, we were limited by the canines. Those were we could only do so much for them and they were extremely overworked. But yeah, in the temperatures, each day was roughly high 80s, real feel mid 90s on, like you said, a phone app. But the real feel temperature with that sun beating down and no shade there was extremely hot. And that's where we brought in, each team had a bus. So we would rotate the members through the buses. They would work approximately 20, 25 minutes, and then they'd go in the bus for about 20 minutes. And we just kept rotating like that. So we had a good cycle and to take care of the health of the individuals while they were out there.
Okay, so Lorna, I'll turn it over to you for questions for Captain Light.
Absolutely. Thank you. I see Kate Ryan already has her hand up. Thank you, Captain Light, for sharing those details about this mission. And now we're going to take some questions. Kate Ryan, WTOP, good afternoon. You're first.
Good afternoon. Thank you so much. And Captain Light, I really appreciate the details you're bringing to us because I think people need to understand just how difficult it was and things like understanding when you said the ground heat, you're talking 170, not 117 degrees, 170?
Correct. The asphalt temperatures were roughly 170 degrees in the mid-afternoon sun in Maui.
Wow. And you also highlighted the work of the canines and their handlers. Are these, my understanding is many different dogs are trained for many different scenarios and quite specific. Are these search and rescue expecting to find live people or are these cadaver dogs? Forgive me, I know it may sound insensitive, but my understanding is there's a big difference.
There is, but these dogs are trained in both. And these come from the task forces, some trained in human remains and live find.
And then in terms of, again, you talked about their human handlers and everyone working that site needed to be 25 on, 20 off to make sure that they weren't being overtaxed. Same thing for the dogs. What special safeguards? I note the fact that you got booties for them, which is wonderful. But what other things had to be considered for them to work most efficiently?
So we did the same for the canines. Those were the first ones to go in to get cooled off, rest. The booties, they had the booties on. And it really, the end of our work cycles kind of were dictated by the dogs and the handlers. Once their dog was pretty much to the point of exhaustion for the day, that's when we would kind of cut operations. We tried to start the incident support team, actually bumped up our operations briefing that we had to go to earlier in the day or an hour early. So that would be at 6 a.m. so that we could be working by 6:30. A lot of that so that the canines have cooler time frames to work in rather than the first couple of days prior to our arrival. They started a little later and they found out real quick how hot it got and they just couldn't continue to work in that kind of heat.
Oh, that makes sense. Two quick questions. Can I get the names? One of them I think is Fife. Do I have that right? Names of the dogs?
You know, so our two dogs were there prior to our arrival. They went out early on the mission. And I do not have the names for the canines.
Okay.
They were with us a little bit. But the canines they had 40, it was upwards of 40 different canines, and they were from all 28 teams across the U.S. So each day we had different handlers, different canines. I was up in the command post and wasn't directly with them, but I do not have. I believe one of their names is Pryor, but I'm not 100% sure on that one.
Okay. And last question, I promise. You talk about the mental as well as the physical tax that that this kind of work has. And I'm wondering, I know that when your teams are out normally, you might have one incident in a day. But in something like this, you are returning to a scene day after day after day. In real time, is there a kind of a decompression or any kind of counseling available to them in real time?
Yeah, so I'm actually glad you brought that up because I didn't talk about that. So on staff, where we were staying, FEMA had their one of their psychologists that was actually assigned to us. She came in and spoke one evening to the team. They all knew that they were available. Also, the International Association of Firefighters were there on site, and every evening they were available. And our very last day, they came and spoke to the group, all of which the FEMA psychologist office will be contacting each member here within this week. And then again, in roughly 3 to 6 months, just as a follow-up, the IFF has been in contact with our union and for members just to check up. And then also our county critical incident stress management team was on hand when we arrived last night or in the morning hours, talked to us briefly, and they're there to check on us also. So there was always that help there. The FEMA USAR branch was on top of it, had them there early for any team, any member. So we definitely had them come in and talk, and then our members were free to contact them And I kind of try to stress that every evening that, hey, if you need to talk, please do. Evening times were kind of a downtime to decompress. We'd have dinner, we'd have a quick briefing, and then just rest best you can and decompress there at our hotel we were staying at.
I appreciate it. Thank you guys very much. Thank you.
Thank you, Kate.
Lorna, for 1 second, making sure that our whole team has the supports now that they're home. It's easy to say, oh, the mission is over. This was a difficult and emotional mission. We are prepared as colleagues to support the whole team that went and their families. We've had conversations while they were in Hawaii. It's interesting that we have Dr. Bridgers on the call, Dr. Davis, Dr. Santiago is the head of our behavioral health division, Dr. Stoddard. We've all been talking about with the leadership of the fire department how we will continue to provide services for the staff members who went to Hawaii, as well as their families who had to deal with their loved ones being gone for 10 days at a moment's notice. So we are aware of the challenges, and we're trying to make sure that all of the team members plus their families get whatever they need from the rest of the county government and the community, which might start by just saying thank you when they see a fire and rescue service personnel around the county, because of the contributions that everyone made. Because even if you weren't in Hawaii, people had to move around. People had to accept overtime. We had to backfill for all of those people that left. So it was a team effort, whether they were in Maui or still in the county, trying to make sure that we were delivering this great service, while at the same time we were continuing to deliver the service that our community has come to expect from the fire and rescue service.
Thank you. Up next is Carney Kohn. Carney from Local 360. Questions about the Hawaii deployment?
Yes, hi, I'm Courtney Cohn from Moco 360. Captain, I just have a few questions for you. First, I just wanted to ask about the number of personnel that were there. I know you said 70 were deployed on the 16th. There were a couple K-9 officers deployed earlier, and then I believe there was also a communications specialist who was deployed earlier. So what was it 73? What was the total number, if you know, of personnel?
The total number would be 73. We had one communications specialist who is a member of the incident support team for FEMA. He was the first one to go, and then they deployed 2 K-9 handlers, and then the 70-person team that went on the 16th.
And are you able to share the name of that communication specialist?
John Freeberger.
John Friedberg. Okay, got it. Thank you. And then also I just wanted to ask about, the team and their previous experience. When was the last time this task force was deployed? Was this the first time a lot of these team members saw something like this, or did they have kind of past experience? What was that like?
So our team roughly goes out the door, I'd say in some capacity, about once a year around hurricane season. We were at Hurricane Ian last year. The year before that, the one in Louisiana. We were Hurricane Sandy. So roughly about once a year we get deployed. The past 3 years, we have worked at every one with missions, search and rescue operations. This one, and all the deployments that I've had personally, this one was definitely the most mentally challenging, physically challenging. It ranks up there with the 9/11s, the Oklahoma cities. And I think we had a few members that went to the Surfside building collapse of the high level, the mental stress. It was one of the top tier deployments we have compared to our normal hurricane ones we go, and all our searching and stuff. But this one here was definitely one of our top ones. So it's roughly about once a year.
Okay, got it. And you had mentioned that you said 8 of the search and rescue teams were deployed. What is it like? How does FEMA decide kind of who's deployed for what kind of disaster, right? Because obviously Montgomery County is like very far from Hawaii. So like, how do they decide like who's deployed or certain teams, things like that?
So for a normal, like a hurricane deployment, they do the 3 closest teams to the incident. They will not deploy teams in that state, kind of like Florida right now. The 2 task forces in Florida were not deployed because they're state assets. And then they do the 3 closest, and then they do a rotational model that is outlined for the next couple of years. They do it goes East Coast, Central, and then West Coast teams. With this one here, they went by the rotation model that we just happen to be, and they rotate every month, where you go up and then just cycle through. And just for the month of August for the national rotational model, we were the first East Coast team to go. So the first teams were Washington out of the West Coast, Nevada out of the Central, and then Maryland out of the East Coast.
Got it. Thank you. And then just one last question. You had mentioned, how special it was for you guys to be able to work with the Maui Fire Department and provide them, the support they needed. Can you just talk about, what that was like interacting with them and talking to them about the work they've already done and just that collaboration? And you mentioned like how you'd exchange flags and the relationships and things like that.
Yeah, our members, they integrated them. We took them in as one of us. They worked extremely well with us. We tried to make the best out of a pretty bad situation. Those guys have been working nonstop since the event happened. They wanted to be a part of it. We tried to take as much stress off of them as can and just be good human beings and talking with them. And it went a really long way. And there's quite a few members who worked hand in hand with them that have now lifelong friends in Maui. And it was just, it just makes you feel good to help out the members of their department who went through so much. And it also, something else to just hit on, we also kind of helped some of the building owners who were there. That most of them lost everything. They had some artifacts and whatnot that they were looking for. Our team members actually helped a building owner look for one of their storefronts and found 2 meteorites that were valued up in the hundreds of thousands of dollars that were, they're pretty much unreplaceable. And just we help them out. So it's not only the mission, we're just good human beings helping out people who need the help. We helped a store owner who was digging through, they had lost everything, just looking for some of the jewelry left that they had in their store, and they found upwards of $2 million worth of jewelry in a case that they had. So it's not just about the mission that they were given, it's just about helping the people of Maui out, whether it's part of our mission or not. It's just being good people and helping out. So it is the same with the fire department, the police department there, whatever we could do to lend a hand to take a little bit of the load off of them for what they've been through, we were there to do. And lots of lifelong relationships made with the residents and the first responders of Maui.
Thank you, Captain. I really appreciate it.
Thank you, Courtney. Members of the media, any more questions for Captain Light regarding the Hawaii deployment? Any more questions?
So as we say goodbye to, oh my God,
Kate has a follow-up apparently. Hi, Kate. Another question?
Is the way your contact with the media is now handled, is that different? I don't recall this kind of lid on information coming out prior to this. I may be mistaken. It's understandable when you have something the scope this big that they want to manage that. But is this new?
This has been very different. We are used to getting approval through the PIO of FEMA for photos of the members operating, team photos, whatnot, interviews. And this one here was very, very strict guidance on media photos. So we tried several times to have some very tactful photos of just no burned items or whatever, a team photo to be approved to send back, because we do like to promote our team. We want you all to see what we're doing, how hard we're working. But it was very strict. None of the deployments I've ever been on have had strict media like this. So it was definitely new. They did call me. I did one interview with NBC, and that was from the FEMA PIO officer. and it was very strict on what I could talk about, and it's kind of like this very general overview, no details. And even to us leaving, it was very strict of do not talk about your mission, do not post photos on social media. We're respecting the cultural sensitivity that they've asked us to respect from the county of Maui.
Thank you.
All right, with that, thank you, Kate, and thank you, Captain Light, for everything that you've done and for your service in Hawaii and your career with the Montgomery County Fire and Rescue Service. And one last thing, it's our understanding that you are a passionate fan of West Virginia University, and I want to join many people around this community in wishing you well against Penn State. For a variety of reasons, there are many of us who want West Virginia to punish Penn State this weekend. So
absolutely, it's going to be a tough one.
I'm sorry, Captain.
It's going to be a tough one.
Yes, but just like the service that you provided in Hawaii, a tough one that you can come through, and hopefully West Virginia will beat Penn State. And I'm going to hear that from a variety of people in county government who are Penn State guys. You know, as a Syracuse person who grew up in Maryland, there's not much you like about Penn State University. So
I agree.
Okay, well, thank you, Captain Light, very much. We are now going to move on to our national, talk a little bit about what National Preparedness Month with our Director of our Office of Emergency Management and Homeland Security, Luke Hodgson. The month of September is National Emergency Preparedness Month. And, you know, when you think about the things that have happened in Montgomery County over the last several years, climate change, bringing different types of storms, less snow, more flooding, there's lots of reasons for every person and every household, every business in our community to be prepared. And Luke is going to talk a little bit about what everyone should be thinking about and what steps you should take in order to be prepared, whether it's hurricane season or year-round in Montgomery County.
Very good. Thanks for having me, Rich. It's good to be here today to talk about this very important topic. For those of you who don't know, the Office of Emergency Management and Homeland Security is responsible for managing large-scale emergencies and disasters in our community. And we do that primarily by coordinating across multiple levels of government, different government agencies, community partners, and the public. So when we talk about these disasters, we oftentimes talk about the response and recovery phase, and they get a lot of limelight. But planning and preparing for those disasters is just as important, and I would argue that it's more important because ultimately it lessens the impact of those disasters and saves lives. That's why each September, as we're approaching now, emergency management agencies across the country join together for National Preparedness Month. National Preparedness Month, as you were just talking about, falls in the middle of hurricane season as a reminder that even though Montgomery County is inland, the county is vulnerable to the effects of hurricanes, which can produce extensive flooding, which is hundreds of miles from the coast. Our community, of course, is prone to many other types of emergencies, including home fires, blizzards, flooding, powerful thunderstorms, high winds, power outages, tornadoes, and even terrorist events. So planning is just so important to protect yourselves and your families, and it's easy to do, which is why this year's theme is Take Control in 1, 2, 3. The 3 steps for emergency preparedness are: step 1, you make a plan. So take some time, figure out how you're going to reach your family in times of disasters. Remember that you may not always be together when disaster strikes, so you need to figure out how you're going to reach your family, and that also includes those who live outside your home. Do you have an in-town contact and an out-of-town contact? We encourage both because a lot of times when that emergency happens in town, phone lines are inundated and you just can't reach one another. Also, you need to have 2 places to meet your family and loved ones in case you need to evacuate. One needs to be obviously outside of your home location, and one needs to be outside of your neighborhood because of the evacuation. And then include in your plan a place where you can go and you can stay when you need to evacuate. And that's for any type of emergency or extended power outage. And be sure your plan considers your children, older adults in your lives, pets, and those with access and functional needs if needed. Step 2 is building a kit. So being prepared means that you have to be prepared to support yourself for 72 hours. That means you need your own food, water, and other supplies for 3 full days. So what I always tell people to do is just think about what you need to survive. Not the nice amenities you may have in your day-to-day life, but what do you need to survive? So water, non-perishable food, clothes, hygiene products, flashlights and batteries. Do not forget your medications. That's oftentimes forgotten. And of course, if you have pets, include food for them, collars, and a leash. And the last step in this three-step process is be informed. Know the types of hazards that may occur. We just talked about some of those, many of which are weather-related around here, and how you'll receive information before, during, and after an emergency. I encourage everyone, if you haven't already done so, to sign up for Alert Montgomery. That's a free service that we offer in this county that we use to send emergency alerts to your email address and your wireless devices. And then, of course, monitor your local weather forecast from the National Weather Service. This year, our national campaign is highlighting emergency preparedness for our elderly populations. And we recognize that these folks are disproportionately affected by disasters. Oftentimes, this population has a smaller support network. They may live alone. They can be on a fixed income or have low income. And oftentimes, they're just not as physically resilient as our younger population. To help this population, our office is going to be at 7 of our county senior centers, as well as Leisure World throughout the month of September. We're going to be providing guidance to our seniors on how they can best prepare and then help connect them with the resources that will help with that. And National Preparedness Month corresponds with Latino Heritage Month. So we're conducting some targeted outreach with our Spanish-speaking community, particularly seniors in those communities throughout the month. So as you prepare, here's a few resources for you. You can sign up for emergency alerts and then find all sorts of additional information, tips, toolkits, workbooks, and resources in many different languages on our website, which is montgomerycountymd.gov/OEMHS. I also encourage you to check out the Federal Emergency Management Agency's preparedness website, which is ready.gov. And lastly, just know that this little talk I'm giving right now is just barely scratching the surface of preparedness. So please follow us on Facebook and Twitter throughout the month of September and beyond, but particularly in September, we're going to be giving you daily preparedness tips and other resources. So Rich, thank you again for having me today to discuss this topic that's so important for protecting our community. And we look forward to engaging with the community throughout September and beyond.
Thank you, Luke, and for the work that you and your colleagues do to, as you just said, keep us prepared year-round. Lorna?
Thank you, Director Hudson. Members of the media, any questions regarding Emergency Preparedness Month or National Preparedness Month? Any questions regarding this topic? Going once, twice? Okay. Director Hudson, thank you so much for joining us today. If you need to drop off, you're more than welcome to do so. If not, you can stay here.
Thanks, Lorna.
Thank you for joining us today. CAO Madaleno, back to you.
Thank you, Lorna. And again, thank you, Luke, for all of those very important reminders. And again, we urge everyone to sign up for Alert Montgomery so that you can get information that we're putting out about whether it's an alert about weather, thunderstorms, traffic. You want to know what's happening in the community. We're able to deliver that information via text messages, emails. So please go to the website and sign up. Just want to go over a few little things. As the fall is coming up, I'm sure everyone is eagerly anticipating our county budget town hall meetings. The county executive when he came into office, wanted to make sure that we had town hall meetings throughout the fall so that residents could come forward and give him their ideas for how we might improve services, where we might put money and facilities. So this year we will have 10 different community forums, one in each of our regions, co-sponsored by the Regional Services Board and Citizens Advisory Boards. Then we will also be having one geared especially to our senior residents. We will have one focused on education that we're working with the Montgomery County PTA Association to pull off. And then we will have one in Spanish, one in Chinese, and for the first time ever, one in Amharic. So we will have 10 different forums to provide people across the county, people of different linguistic needs, people of different areas of the county, the opportunity to come forward and talk to the county executive. Certainly council members come out, to all of us about what's happening with the budget and what changes they'd like to see for both our fiscal year 25 budget, which will start next July 1st, as well as our 6-year capital improvement program. This is the year, you might know, we have a 2-year cycle with our capital improvement program. And this, on January 15th, the county executive will be introducing the new 6-year plan. And so this is the great opportunity to come out and talk a little bit about what you want to see in the budget, or learn about the county executive's priorities and how the county is structured from a budget standpoint. There are nerds like me who enjoy budgeting and numbers, but these forums are always put in, we try in plain English or plain language so that people can understand their budget process, and certainly talk to the decision makers about what they want to see over the next year, or in this case, the capital budget over the next 6 years. Tomorrow is International Overdose Awareness Day. We will be having a ceremony on the plaza behind the Executive Office building. We will be joined by the leaders of the Department of Health and Human Services to talk about both the impact of overdoses, the people who we've lost over the last year, and how we all, as residents, as households, as loved ones, neighbors, family members, can be aware of the signs of drug use and what we have to do in order to combat overdose. Very happy to welcome Lieutenant Governor Aruna Miller, a Montgomery County resident, to tomorrow's event. So if you are interested, it will be, as you can see, it starts with a resource fair at 5. At 6:30, we will have a kickoff event. We'll have food, and then at 7:30, we're going to have a candlelight ceremony and vigil to remember those in our community who've lost their lives due to overdoses. So please join us as we go forward with Montgomery County Goes Purple. This is our 7th year of doing it, and this might be, of course, the biggest event so far. If you or anyone you know needs immediate help with substance misuse, please call our 24-hour crisis center at 240-777-4000. 240-777-4000. That actually joined a lawsuit against the pharmaceutical companies that pushed opioids on our nation and to so many vulnerable people. So we're thrilled that we have made progress on those lawsuits with our partners around the country. And in fact, we have received $1.6 million already as part of our share of the settlement to put towards substance abuse programs. Once again, Labor Day is on Monday. County government will be closed. It's important to note that County Executive Mark Eldridge has been committed to labor, and he's been committed to raising the minimum wage. People may know we have a separate minimum wage law in Montgomery County by size of business. So on July 1st, our minimum wage for employers of over 50 people went to $16.70. Our mid-size employers, 10 to 50 employees, went to $15 an hour, and our 10 or below small businesses went to $14.50. Now, Governor Moore championed the idea of a minimum wage increase at the state level. So the state minimum wage will go up to $15 on January 1st, thanks to the initiative of Governor Moore and Lieutenant Governor Miller. That will mean that for all employers in Montgomery County, you will have to pay no less than $15 an hour minimum wage. And then, of course, starting next July 1st, our county law will again adjust the minimum wage higher. Unfortunately, from County Executive Eldridge's standpoint, the General Assembly did not include an automatic inflator in the minimum wage at the state level, but I believe the county executive and the governor will be back to talk about that issue in future legislative sessions. So we are going to turn it over now to our Health and Human Services team to talk a little bit about this week's health report. I know we've gone long. It's been a very interesting briefing, and of course, to hear Captain Light talk about what happened in Hawaii. But at this point, I'm going to turn it over to Dr. Bridgers and Dr. Davis.
Thank you, Mr. Madaleno. I will be brief. I'm sure folks have heard that COVID cases are increasing lately. This is not a surprise. Over the last few years, during the kind of late summer timeframe, we have seen wavelets of COVID, so it's kind of an expected part. It may be part of the trend that we see with this virus to see a summer as well as a winter wave. We will just share a little bit about the numbers of what we're seeing right now. And just a reminder on vaccines, a lot of folks are talking about vaccines right now. The new vaccine should be available late September, early October. This would be targeting, again, the Omicron strain, but the one that has been circulating, the XBB variant. We still think that it should offer some good protection from what has been circulating most recently. A reminder that this is the first time that the COVID vaccine is mostly available through the private market. So through your primary care provider, through pharmacies. The health department will also have some available, but we are encouraging most folks to get their COVID vaccine the same way they typically would get their flu shot or any of their other routine vaccinations. The RSV vaccine will also be available later on this fall, and we recommend that folks who are 60 years and older to get that. So just a little briefer on where we are. We have seen an uptick. You can see that slight rise. However, we still do remain in low with community spread. Just under 24 cases per 100,000 residents in the last 7 days. We depend a lot on PCR positivity, and we recognize that folks aren't testing as much as they used to, at least not getting the PCR testing. A lot of it is home testing, which isn't reported in the same way. And so because of that, we also look at other data, some of that being wastewater, and we've seen some upticks there, but also looking at hospital admissions and ER use. Can see here with the PCR positivity and where we sit. I think last week there were still a couple spots of green, but now you see across the state, everyone has really seen that increase to cases of 1 to 10 per 100,000. And you can see the average percent positivity for Montgomery County is right around 15% for the last 8 weeks. If you zero in here at the bottom right corner, that's looking at hospitalization and ICU beds. As of Monday, across the state, across in the county, there were only about 2 ICU beds occupied by COVID patients. We know that that's gone up a little bit over the last few days, but still hospitals have quite a bit of capacity. And what we're seeing with this illness is that it tends to be pretty mild, and that the folks who are needing to be hospitalized are the ones who already have many comorbid illnesses, and folks who aren't vaccinated. So again, we encourage people to take those precautions. Just looking again at Maryland and hospital beds versus ICU beds. Just looking specifically at Montgomery County and the hospitalizations that we've seen, very low numbers. I think that is quite reassuring, and we've seen a little bit of a decrease over the last couple of weeks of August. And we'll just remind folks where they can get free COVID vaccinations, as well as where you can get test kits. They are available to be picked up at the libraries. We encourage folks to take precautions, wash your hands, stay safe. If you are immunocompromised or at high risk, you may want to consider wearing a mask if you are in a place in large crowds or tight spaces. And we do encourage folks to get the new vaccine once it becomes available later this fall, and we'll have more information to share as that becomes available.
Okay. Dr. Bridgers, do you have anything to add?
Mr. Madaleno, nothing to add. Dr. Davis picked up the one point that I was going to touch on, as she repeatedly reminds folks in the Department of Health and Human Services in her role as the Chief Medical Officer, but also as the county's health officer, to wash your hands. It's one of the most proven effective public health practices to prevent and mitigate the transmission of disease. We know we're moving into the fall, and we will have and may see cases, however remote, of RSV, flu, and COVID. So she continuously reminds us to wash your hands, wash our hands. So that was one message that I wanted to pick up on. But of course, as our Chief Medical Officer, she touched on it. So thank you for that.
Thank you, doctors, both of you. Members of the media, time for questions regarding public health and other topics. Kate Ryan, WTOP, good afternoon again.
Good afternoon. And doctors, yeah, I do have a question about schools. Are you seeing and are you tracking separately incidents in schools, or again, does that fall to Dr. Kapunen? And I don't know what kind of, I don't want to make it sound panicky or anything, but like a watch level, or how carefully are you tracking? Because obviously when kids are close together in schools, particularly the little guys who, personal space is news to them in many cases. What are you seeing so far, and what precautions are you asking schools to take?
Thank you for the question, Kate. So we haven't seen that yet, although it's only day 3, so a little bit early to see what the numbers are looking like in the schools. The schools are encouraging folks to test, but they aren't requiring them to report in the ways they had in the past. We have a really close relationship with Dr. Kapunen and the school system, and also with the school nurses. And so we have kind of that eye view. Are there more cases? I will say I've got 3 kids in the school system, and they all came home with sniffles. None of them COVID. And so just recognizing that as kids get back together again, they probably are going to be encountering some respiratory illnesses, and that goes back to the importance of washing your hands. But we do regularly communicate with the school system in terms of what their COVID levels are and what they're seeing in the classrooms.
Thank you.
Thank you, Kate. Jeannie Bixby, Local 360. Good afternoon, Jeannie. Jeannie, do you have any questions?
Sorry, I was still on mute and just talking to myself apparently. I think at this point. Hi, Dr. Davis and Dr. Bridgers. Obviously, you shared some of the precautions that we've been taking throughout the pandemic, like washing your hands, wearing masks in crowded spaces. Could you kind of elaborate on to what level of caution you would advise residents to, I guess, return to? I think a lot of us have gotten a little lax with how effective vaccines have been, that, we haven't necessarily been wearing masks as much. What level is advised at this point?
So I think most folks have a good level of protection from previous vaccinations and from potentially having the illness in the past. But you want to, I think this is a conversation to have with your physician, but also thinking about what your personal level of risk is. And that conversation is going to be different for someone who may be elderly and have many comorbid conditions or be immunocompromised than someone who has a generally healthy immune system and may get COVID, which is something that we don't want to have but not be severely impacted. And so we are not at the point where we are saying we need to go back to mask mandates and things like that. But, if you are going to be traveling, if you're going to be around elderly grandparents, you may want to take a little bit more precaution.
Thank you.
Thank you, Jeannie. Members of the media, any more questions this afternoon? No more questions for the officials? All right, going once, going twice. I guess we're done for today. Thank you very much for today. Yes, go ahead.
Just want to say, just remind people the event tomorrow for International Overdose Awareness tomorrow on the plaza behind the Executive Office building, and to let everyone know that probably it's on everyone's calendar, but our next media briefing on September 6th, 1 week from today, will be the 247th birthday of Montgomery County. So I know Kate Ryan probably already has a cake on order, but for those of you who may not be as prepared, it's important to note that Montgomery County was created by the Maryland General Assembly on September 6, 1776. We're the oldest and first Montgomery County in the country, so take that moment in 1 week to celebrate our 247th birthday. And thank you to everyone who joined, and of course, continued thanks to the members of the Fire and Rescue Service, those who deployed to Hawaii, those who filled in the gaps in the county, and of course their families and friends who supported them while they were gone on that mission. And with that, I'd like to thank everyone for joining us, and thank you, Lorna, for moderating.
Thank you very much. And thanks for sharing that historic data. Very welcome. 247 years old. Wow. All right, everybody, we're done for today.